And there we go. We are officially live. I'm just going to double check and make sure we are live on the other side on YouTube, making sure that we are streaming. Otherwise, it might be going to double check and make. Oh, there we go. Okay, we are officially live. Hello, everyone, and welcome to another In Conversation with Nissy Tee. I welcome you back. I'm super excited to be back for another Sunday with another incredible special guest. By the way, before I even get to our guest, massive shout out to every single one of you. Some of you guys, Nosy 360, who's literally been waiting since 5:48, literally waiting for this conversation to happen since that time. So super excited, very honored to have you, really happy to have you. But yeah, welcome back to In Conversation. Here it's all about having real conversations with real people that go below the surface level. We want to go not even below but beyond the surface level. It's really important to have in-depth conversations, real conversations, open conversations with people who, you know, I truly do believe should be able to share their voices and their opinions as well. Obviously, of course, I have to give a massive shout out to Little Drops Productions. That's who we normally work with when it comes to these interviews. We normally do them in person. So thank you so much to Little Drops Productions for all of their amazing hard work. Obviously, because of Corona, we are now being forced to do everything online, unfortunately, but also fortunately, because it means that there's no limits and no boundaries. But yeah, thank you guys so much again for joining us this evening. Now, I have a very special guest who is joining us today. She's looking gorgeous and fabulous all the way on the other side of there. So we are joined by, and I'm going to try and give her as much of a great introduction as I possibly can. But ultimately, she is a GP. So she is a GP. Let me get this right. General practitioner. Is that correct?
That's right.
I did my research. There we go. So she is a general practitioner who I actually met at a women's event, actually. So it was a women's event that a friend of mine, amazing, she goes by Mimi. She runs a hair salon called Mimi Amina in Notting Hill. And she had an event and we were there. We got talking and we stayed in contact. And then I thought, do you know what? This is the perfect time to bring her on. So she's actually been practicing as a GP for 5 years, been a doctor for over 10 years now. So when I tell you that she knows what she's talking about, believe me, she knows what she's talking about. She goes by the name of Dr. K. She also has an Instagram page and a YouTube channel as well called Dr. K Explains, where she puts up lots of incredible content explaining and breaking down, medical issues, giving advice, getting rid of myths, which is something that we're going to be talking about today, and ultimately presenting health information in a way that me and you can understand away from all of the jargon. So Dr. K, hello and welcome. How are you?
Thank you for that introduction. I mean, my head is so big. I'm just like,
I love it. It's you.
But,
and let's keep growing. I want it to keep growing. I want it to keep getting even bigger. You deserve all the accolades. You deserve it.
Thank you. And Nissy, honestly, yeah, it was a pleasure when I met you. I think it was fate, whatever it is. But I think it's such a good opportunity for us to be here tonight and just kind of lay it all out open and talk about whatever health issues or any questions that anybody has. And yeah, I'm just ready. I'm just full of excitement and I'm ready to go.
I'm so glad. Thank you so much again for joining today. But how are you anyway? How are you? Obviously, quarantine, Corona. I know that you, of course, are a key worker. So you're still technically working. How is everything going?
It's been strange. It's a mixture for me of old and new. Obviously, I'm still working and some of my job still involves seeing people and seeing patients face to face. But the funny thing is that there's more technology that's kind of come into healthcare. And for so long, it always seemed like, an old boys club, very antiquated. Oh, we don't do things like that. Everything's still pen and paper. Now, everything is all Skype, internet, phone. And that's also a key part of what I do now. So it just means that my week is very diverse, a lot of using technology, which I never thought I would be able to do in such a way. And then still I'm doing what makes me happy and seeing people in person and just doing my job in the way that I know best.
Wow, amazing. And again, I know that we've been like appreciating people that are basically on the front line quite a lot, but I just want to take the moment as well to appreciate you. Honestly speaking, you know, if it wasn't for people like yourselves, the doctors, the nurses, even those actually who have lost their lives, you know, serving our community, serving people, if it wasn't for that, I genuinely can say that we wouldn't know where we were. So honestly, from myself, from everyone who's probably watching now, we appreciate you, we applaud you, we thank you, hoping that, you know, some raises will happen, not just applauses and claps.
I know, I know, I know, I
Paycheck
know.
will also elevate just a little bit.
I know. Keep sending those vibes. You know, we need all the help we can get.
No, I appreciate it. But just walk us through a little bit about your journey, obviously, to becoming a GP, a doctor. You know, it must have been a tough journey because being a doctor and doing what you do is not easy. So just talk us through your journey just a little bit.
Yeah, it's crazy because for me, I know people say, "Oh my God, it must be really hard" or whatever else, but it's funny to say, and I'm not trying to play the kind of bashful character. It just generally wasn't. It was like the way I think about it is I heard this weird poem or weird saying, which is, "How do you eat an elephant? One bite at a time." And that's what it means. It's like whatever option, whatever opportunity, whatever obstacle that you had, every day at a time. So, and that's the same philosophy that I had as well. So in terms of growing up, I was not born in this country, obviously born to Nigerian parents. Obviously, like a lot of people from the diaspora, came here when I was little. But my family were always really into, you know, achieving things, and kind of my parents really pushed me like, you know, don't be limited by your race, don't be limited by your gender, don't be limited by whatever beliefs that is holding you down. So they really supported me in terms of going through the whole process. Medical school, you know, you kind of, again, if you think back like, oh, I can't do it, then you're not going to do it.
Right.
But if you think, why not, then you will, or you will find a way of doing it. And that's what I think. I'm really good at finding ways to do what I want. So I don't like hearing no. So I always kind of just find ways to do what I want. And that's what approach I took through my training. And then, you know, for most of my time, I was actually up north in Yorkshire. So that's where I did most of my training. And then for the last 5 years now.
I could hear, like, I remember, I think I asked this the first time we met. I was like, there's a little bit of an accent. Like, you sound a bit northern. I don't know if that's a good accent.
Northern,
a little bit northern. I was like, it's a bit different.
And the funny thing is I went to university in Liverpool as well. So it's a bit of a mixture, a bit of a Scouse accent, which comes out a little bit at times.
Yeah.
So, and then the last 5 years I've been kind of in London, trying to like live it up with you London people. That was really bad. But
it's all right.
Anyway.
With my attempt to be northern. So it was just bad. Cool.
Yeah. So again, you know, I've just through all that time, I've just been collecting experiences, training, keeping my head down. And now it was just an opportunity for me to kind of, right, I've gone through all of this.
Right.
What can I do with it? And who can I help with it? And people that are like me, like you, like all the, you know, people watching and streaming this video, these people are my kind of people. And these are people that I really want to reach out to and connect to. So there's no point in me gaining all this knowledge and reading all these textbooks if I just kind of keep it stored here. It's supposed to be, you know, you disseminate all this information out so that whoever's watching, even if they take one bit away, they feel like I've at least gained something, and I feel better.
No, I love that, and we appreciate it. And you know, even I'm looking at the comments now, I'm seeing the Alkabulan Trust giving you applauses there, Khadija Dreams giving you applauses, Ropa Mungwari giving you applauses. So there's a lot of people that are applauding you here. And also to anyone who is on the comment section, listen, ask your questions. Of course, today we're talking all about Corona, the virus, you know, the disparities between the death toll, especially in regards to the Black community, and also talking about vaccinations and vaccines. So if you have questions in those areas, please make sure you ask them so that, of course, over time, I'll go through them as well. But I want to dive straight into actually what we're experiencing now. So of course we're in a pandemic that most of us in our lifetime have never experienced and never seen. Some people even likened it to World War, you know, the wars, basically saying that it feels like that. It feels like that level of pressure, but also community and solidarity between everyone. But I still feel as though there's still a real confusion about what corona really is and how it gets passed around and how people get infected and should we wear masks and should we not. And there's a lot of confusion even around corona itself. So I was just hoping that you could start maybe by breaking down how this disease actually even works and how it's actually spreading, just in case people don't know.
Okay. I think the first thing to say is that this confusion that you're feeling is actually being reflected all around us. Even the so-called people in charge, there's a lot of confusion there because this is something that is completely unknown to us. This is a completely new virus that we've never come across before. So, you know, we're learning things. And as we're learning, we're having to kind of, you know, get 2 steps ahead. So in terms of, you know, the information that we're getting, it comes out in bits and bobs. And obviously we're now in May and we know much more about it than what we did back in January. Yeah. In terms of coronavirus, the actual name coronavirus just refers to a group of viruses. Obviously, we use it to refer to this specific one, which is COVID-19. And I know there's a lot of theories out there about where it came from. At the moment, what we think is that it came from a specific part of the world in China. Whether that's true or not, whether it's from this, that, and we think that it was from, you know, animals. And coronaviruses, which is the group of viruses that we're talking about, do exist. I mean, we've had things like SARS that came out several years ago. So we've had different times in history, little bits that come up, but the game changer is learning how infectious this is. You know, it's basically spread like wildfire. And the fact that initially people didn't even think that they just thought it was something that you pick up from being around animals or wildlife. So the moment that we realized that actually, once you get it from someone, you can then pass it on to somebody else, and you can pass it on to so many people, usually by, you know, breathing in when they sneeze or the cough, or you kind of touch somewhere that's been contaminated with your hands, and then you go on to touch your face. That was the key changing point in knowing much more about coronavirus and knowing that it's a real problem. It's not just something like Ebola that was back in Africa or something that, you know, you could ignore. It's now in your backyard.
100%. And do you know what? I love that you even mentioned even the comparison between what's happening now and Ebola, because I feel as though when Ebola was happening, because it was deemed as the African disease,
exactly,
people weren't really bothered. We didn't see as much of a response as we are now. People were just kind of like, oh, that's that thing that happened in Africa. Nobody really cared about it. But then now, because this is happening here in the UK, in the Western world, all of a sudden turned into a pandemic. Have you, you know, how have you felt kind of seeing the disparities even between the way that these things in the past have been dealt with and now?
Okay. First of all, I will preface this by a disclaimer and saying that this is just me kind of having these weird and wonderful thoughts about it. And a lot of these are my own kind of thoughts, and they're not, you know, a lot of times it's just based on what I've heard, just the same way as you have.
Of course, yeah.
In terms, and I've come to that conclusion because of what I saw, what happened with Ebola and the approach to that, and the fact that, you know, there's an element there again to do with you know, what happened in the others. And again, as much as we like to ignore it, my personal opinion is that also the kind of, you know, it was to do with people in Africa, already an area of the world that people don't really understand, and they can kind of look away. So the fact that, you know, when this started and it was in China, initially, I feel that that was what the approach was going to be as well. Like, oh, it's somewhere, it's just in a small pocket of the world. It doesn't concern us. We can still carry on with life as normal. And then when it started to spread to other countries like Italy, and I think that was when people were like, oh my God, this is not going away. And that's when things really started to accelerate. So for me, it's a clear difference in how we treated one condition versus what's going on now with coronavirus.
Yeah, most definitely. And even as we were on just a little bit before we went live, we were obviously talking about the fact that work has really changed for you as well with everything that's going on at the moment. So, you know, where once technology and medicine, of course, it oh, sorry, we went off for just a second there. I thought that we had just disappeared. But yeah, how are you basically finding work now and dealing with patients? Are you still, you know, physically having to meet people in person? How's that going?
Yeah, I think there has been positives that's come out of this, most definitely. I feel like people, you know, the whole approach to, you know, praising people that work in the NHS and understanding the jobs that we do and the decisions that we face, that is definitely, you know, that's something that does fill me with positivity and does make me feel humble as well at the same time, you know, because sometimes before, you know, because there was a lot of things going on, it's always going to be a very complicated issue when you talk about health and the NHS. And I
Yeah.
feel like now people are much more on the whole, you know, let's all come together. So a lot of times it's not like you versus me anymore. It's like we're together. We're both, you know, as much as I'm explaining this to you, you're also understanding what I'm trying to explain. So we're both working towards a solution. So
Yeah.
yeah, influenced my job in that respect. It's made it definitely a positive environment to work in. And
Yeah.
it's funny for me to say that whilst we're in the middle of this pandemic, but it is more positive in
Yeah.
terms of people being more appreciative.
Yeah, most definitely. And even with yourselves as well, I'm assuming that you're using, because I know that there's an app at the moment, like the NHS app, so people can use that if they want to, you know, contact their doctors, etc. And that's actually something that I wanted to ask for those that, you know, even now, because I was, you know, looking at the news reports and it was saying that, you know, basically in 7 days they haven't tested as many people as they said. They had like a goal to test 100,000 people every single day. They're not meeting those goals. And then now, you know, they're kind of looking at relaxing the whole stay at home situation. How are you feeling about that? How are you feeling about, you know, us shifting now into a new space where it's kind of like, okay, maybe let's relax it a little bit? Or are you thinking that maybe it's too early? Where are you kind of at with that?
Yeah, I mean, before we did this live chat, Boris, which is the Prime Minister, came on and did a quick broadcast, and he was talking about now changing the focus from stay at home to stay alert. And I personally have some doubts about that. I mean, yes, when you look at the numbers for COVID-19, you know, before it was like this, like a complete deep thing. And now the curve is starting to flatten out. But I just feel personally like, you know, we should wait until this is more of a an actual decline
Fine,
before
rather
we start to relax the laws. And I
than,
feel personally as well that, you know, by going and doing things too early, you know, we're potentially opening ourselves to, you know, maybe a second wave or like another rise again. So I personally, I think I understand that from the economy and people getting fed up of being at home, because it's been 8 weeks now that we've been at home.
yeah.
I think we still need to knuckle down for a little bit longer. And then when it's safe to come out, then we can come out. I kind of feel like, you know, we kind of, if we're drawing comparisons to the whole World War II, the Blitz spirits, let's just knuckle down in the trenches for a little bit longer
Yeah.
and then, you know, come out. And I also was going to say that his speech was just a little bit, it wasn't very clear. There wasn't, it was saying something, but then I'm still a
But
bit
with the,
confused.
yeah.
Yeah, I don't know.
And are you finding that that's affecting how people are responding, even in when it comes to the health service? Because I do think that, like you've said, you know, sometimes things are said and it's like, oh, but does that mean this? Does it mean that? How are you finding that people are even responding to you as a doctor? You know, are people kind of more concerned, like, I don't know what to do?
Yeah, yeah. And that's been the same at all the stages, to be honest, in this whole COVID-19 journey. I think at the start, when we weren't very clear, people were like, should I be worried? Should I not? And I was like, well, we think so. And then obviously when the lockdown came into effect, I was a bit more I had more information to say, look, this is what you need to be doing. You need to be at home 7 days, blah 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 blah. And that was much more concise. And I feel like that's, you know, Because the thing is, we're the frontline staff. We're the ones that deliver the message to patients. It's not
Right.
Boris or, Public Health England directly. They pass on the message, and then we're supposed to, interpret it and tell you guys what we should be doing. So
Right.
if the message that we're getting is not clear, it then it's like, so should we tell them no, yes? And it makes it
Yeah.
harder to refer people. But I hope a bit of common sense and a little bit of cautiousness is the right approach to take.
Yeah,
At
I
least
feel
we know more.
yeah, definitely. And I feel as though we're all kind of in the same boat. Everyone's kind of a little bit like, I'm not too sure, shouldn't we? And I even actually saw some stats. So according to CNN, they were actually saying that about 70% of people still wouldn't feel comfortable even if the lockdown was over and they said, you know what, you can go back not to a normal life, but we're kind of, easing the lockdown a little bit. About 70% of people said that they wouldn't feel comfortable going to restaurants. 70% of people said that they wouldn't feel comfortable being in public openly. So I feel as though that there's an attitude with everyone that's still a little bit precautious. But then there's also the individuals who don't care and who are literally out there going out to the park when they should only be going for a run, going to the park. I mean, what would you even say to those individuals as somebody who's actually a doctor, a healthcare professional, someone who has to deal with the consequences of people doing these sort of things? You can be as honest and as open and as raw as you want to be.
Can you see my face? I wrestle with this because I was driving to work on Thursday, and there was a park near to where I'm driving, and you could see people just going. I saw this mother, and she had a baby, and I'm sure the baby was probably about 4 months old, and I was just like, oh my God, what are you doing? Like, please just stay at home. And I get really frustrated, especially when this was still, when the lockdown was still starting. And, it was still trying to get the message through to people that, look, this isn't a drill. This is real life. And it was kind of, I just wanted to shake some sense into people because on one hand, I have friends who work in hospitals, in the intensive care units and stuff, and they're having to make decisions about who deserves a ventilator because there's so many people that are sick and there's not enough machines to keep them alive. And then you're out here in the park sunbathing because, I can do that. I just think it's irresponsible. And obviously we live in a free society and I can't physically make you do what you don't want to do. But I just feel like, we need to start thinking about other people. It's not about you. If you're physically well, you never get sick, you've got the immune system of an ox, that's fine, you're fine. But it's that person that you pass on your way to the park who takes, who gets sick. And because we don't know about coronavirus, there's all this about people who have coronavirus and don't have any symptoms or are carriers or they're, super spreaders. You don't know if you happen to be that person. And you've just, from your selfishness, you've potentially caused other people to be sick. I just really, really struggle with that.
Yeah, and I'm just going to go through some of the comments actually. So Khadija Dream said, I'm personally keeping my kids at home until September, no matter what they say. She said, you could tell me to tell my kids to go to school, they're not going. She even actually added there were loads of parties this weekend, which I've actually heard. Loads of street parties, loads of barbecues, loads of different things going on. And Dave East, by the way, he's come with a couple of conspiracy theories, which we're going to be touching on in just a little bit. So don't worry, Dave, I'm going to come back to your comment in a second. But yeah, honestly, even someone called Hello, somebody said, I won't be comfortable until after a year of going out. I mean, for yourself, if they do decide that in a few months, they say, okay, we're going to open up your doors. What do you think that we should be doing to allow ourselves to, I guess, not necessarily rush back into that normal life? What should we be doing, or things that we should be putting in place in order to make sure that we're as safe as possible if this, if they do decide to kind of let everyone kind of come back out of their homes?
I think first is for you to develop this critical thinking in terms of processing what information that you receive. The same way a computer, you might type something on a keyboard and then what comes out the other end is different. I think that's the first thing, to have that kind of critical approach to information, whether it's through the news, whether it's through the WhatsApp message that you're getting, whether it's through Instagram. So that's the first thing, and just judge it and assess for yourself. And also, so that would be my first thing. The other thing is that hopefully during this whole quarantine and lockdown period, we're already adjusting our lives. We've got kids at home who are homeschooling, and we've kind of figured out a way to make it work. For those of us who used to work in the office and did a lot of jobs with other people, we've kind of slimlined that and we're working from home. So adopting all these things that made it successful for us during lockdown, hopefully as we now go out of lockdown, I wouldn't just hope that people just like, oh yeah, okay, fine, I can just go back to what I was doing before. Maybe just, you were working from home, during this time, maybe have a gradual ease down, speak to your workplace or your manager, is it possible for me to do this, like a reduce, like a phase return type of thing. That's personally what I would do. Obviously, some workplaces are not so accommodating. It depends on individual circumstances.
Yeah.
And also the whole washing hands and the masks and everything else.
Yes, most definitely. I think, of course, the whole hygiene aspect, let's not forget that. Let's not just think, oh, they've said, lockdown is done now. Oh, let's go back out. Because I think the fear that a lot of people are having is that second wave, which is something that obviously was seen, in 1918 when they had the Spanish flu. And then it was
research.
Oh, listen, I can prepare and I can to be very honest with you, I've always been a bit of a nerd. So I've always been that person that reads up on a lot of stuff. When Corona first came out, I was like, I need to find out what this is. So I was there like, what is happening? But it's important that we educate ourselves, because if we don't, all the information that we get given is basically information that people just want you to have, and it's just regurgitated. So it's important for us to, to go and do that. Now, talking of information that I think that we should be talking about, I really wanted to talk about the disparities. Is a huge topic of conversation. In fact, even today, I saw a number of reports. I saw a number of, people basically pressuring the government to set up an inquiry. And I'm going to give you guys some statistics as well, just to kind of give you a bit of an understanding of what we're going to be talking about now. So we're going to start with the UK and then possibly and then move over to the US. Hopefully we'll have enough time to talk about this in detail. But according to an article that I actually read from the BBC, the ONS, which is the Office for National Statistics, basically said that Black people are 2 times more likely to die from corona. But then the Guardian then went on to say that they're 4 times more likely. So then I was a bit confused. So I was like, okay, one saying 2 times more likely, 4 times more likely. What is it? What's going on here? So then I later read, if you take into account a variety of different factors, from age differences, various different factors like, geography, where do these people live, if they have underlying health issues, whether their homes are overcrowded or not, whether or not the person works on the front line, for example, like nurses, doctors, etc. That all contributes as well. But either way, even if you take those statistics into account, there is still a disparity. Black people are still nearly twice as more likely to die, to have severe issues and complications and go to ICU in comparison to their white counterparts. And my main question, and I'm sure a lot of people are wondering, why? How? Why do we have a disparity in the UK? How is this even possible? Just wanted to know some of your thoughts on that.
It's crazy to me. It's absolutely crazy. And I've got some WhatsApp groups as well with some other doctors, and we're just talking about this because it's absolutely mad. This whole statistic came out, I think, in the last week. And it did show the wide gap between Black and white. And the thing is, we've known actually that when it comes to health anyway, Black people and ethnic minorities, we are always in last place. We've always known this. It doesn't matter. We're talking about COVID-19, but this is not new. We've known that with other health conditions, we've always had it worse. Okay. Now it's come up in our face that when it comes to COVID-19, where even, we're not playing now. People are dying, people are being really sick, and we don't know why. A lot of people are talking whether it's to do with all the factors that you mentioned, whether it's the fact that we tend to be more, we do all the jobs that, mean that we're in the front line. So, if we're the delivery drivers, supermarket workers, we work night shifts. I've got family members of mine, an auntie that works as a nurse. You know, I'm obviously a doctor, and I've got other people as well. And, you know, we take up all these roles, and that comes with risk as well. And it means that, you know, we're taking up all this, you know, it seems that we're kind of absorbing all this at a cost to our lives, and we don't know why. So hopefully, as time goes by and they do more research, we figure out exactly why. I also read in that news article as well that it broke it down by different Black ethnic groups.
Yes.
And it was looking at between the Caribbean, or, you know, Black Caribbeans, Black
Yeah,
Africans,
Black African. Yeah.
and yes, so we are really, really at a disadvantage. There are so many reasons that we can talk about as to why this is. I mean, but I think we definitely need to be doing more research about this, because it is a shock. It's a travesty that it's happening. It really is.
Yeah, most definitely. And I think for me, it adds an added element of a little bit of, not necessarily fear, because I feel as though it's really important for you to stay positive. It's important for you to really remind yourself that, listen, you just have to, you know, do all the precautions that you can, and that's all you can do. Because I personally am a strong believer in, you know, fear, worry, anxiety is not going to change the situation. That's just me personally, you know, not to downplay anyone's emotions or anything like that, but just me personally, I try not to play on that. But it does definitely concern you when you're there thinking, oh my gosh, wait a minute, you know, myself, my family, you know, my auntie, my uncle, whatever, we are twice as more likely to pass away and to die from this disease. That in the past, if you even remember at the beginning of the conversation, before it was like, oh, Black people are immune. I don't know if you remember hearing that.
Absolutely. Yep. We had some superpower because it wasn't spreading in Africa. And there were, you know, I would read news articles about, why isn't it in Africa? And I was like, well, because we're special, aren't we? And then now we're like, we're dying. It's such a massive U-turn. It is crazy.
Such an insane U-turn, you know, literally, like you said, it was like, yeah, no one was getting it. And then all of a sudden it's like, wait a minute, how are these, you know, disparities kind of happening? You know, for me, I wanted to kind of ask you, how are you, even in your own line of work and in your field of work, how does that affect you day to day when you maybe have patients and people that come into your workplace that look like you, and you have to ultimately treat them, you have to deal with them? How does that affect you in your work?
I try and have empathy because I share the background, so I can put myself in their shoes, and because it's easy for me to do that because we share, you know, some commonality. Okay, so I try and have more empathy in terms of, you know, I feel like you know, some people might say, oh, you're going the extra mile, but I feel like, yes, you should go the extra mile and, you know, make sure that you explain things and you do things. Obviously, I treat, you know, people, you know, I don't like discriminate and say you get this treatment and you don't. But I find myself going the extra mile to just, because I just feel for people. I feel for them because it's like, you know, you could be my auntie, you could be my brother, my sister, friend. It's just, so I just feel like I just want to give extra, because in every other walk of life, you've been shortchanged. So wherever I can contribute and at least level that playing field in a way, then I'm going to do my best to do that.
Yeah, no, 100%. And I feel like, you know, we've always heard stories, and we've heard incidences of especially Black women who go into basically into whether it be hospitals or they go to see nurses, and stories of people who either don't get believed because there seems to be this idea or this perception that Black people or Black women can actually handle pain more. Yeah. And you know what's actually insane? A lot of people might just say, oh, those are just things that people say. But if you look historically, you know, I remember at the time at university, I was studying post-colonial studies and looking at it historically. I mean, this was actually, they used to state it, people used to state it as a known fact that Black people can handle more pain because of what we've had to endure in the past. So even with your, you know, with yourself, I don't know if have you got any children or any young children at the moment?
Not children, not yet, but still work with lots of kids and you see them running around.
Yeah. So one of the things that I was going to ask you, again, as and when if you do decide to have children, if you don't, but what are some of the things that I guess, we should be teaching younger generations, children, to understand when it comes to health, and whether it be looking after yourself, or whether it be when you go to a doctor and a doctor maybe doesn't believe you, or doesn't believe that you're sick, or doesn't believe that you've got symptoms, or whatever it is. What should we be saying, especially to the younger generation growing up during this time?
Okay, that's a very good question. I'm going to offer part of the solution. I think the solution is much bigger than me. I think the first thing is that we need to start using our voice, and we can use our voice individually, like you said, on one-on-one to children, but also as a community and as a collective as well. So when it comes to, if I was speaking to a child, I think the first thing is what I said before about critical thinking.
Right.
There is no excuse now to not be informed about things. There's no excuse, because we've got so much more information now. And back then, the information was separated from us. We had to go through hoops to be able to access that information, or it was kept away by people that were that had their own agenda. Now, I feel like the internet, social media, all that kind of technology has leveled that playing field. So we can go out there and find out. I mean, I want to know about this condition. Click, 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 Google, I find it out. So that's the first thing that I would say. And lots of people like me, setting up channels, lots of doctors as well that I follow on social media that are using their platform for good. So always finding somebody that you like, you identify with their message, following them, and and just kind of, using that in a way for good. So that's the first thing. And then the second thing is just still not refusing to be kept silent. So if there's something that is there, it doesn't matter where you go and see one doctor, two doctors, three doctors, just keep going. Obviously, using the information that you've learned from the first thing that I said as part of what you're presenting with. So, people are much more likely to take you seriously if you sound as if you know what you're talking about, and you've organized your thoughts and you've organized what you want. So that's the other thing that I would suggest as well.
No, so definitely some great advice. And I'm so sure that there's even people on here right now that probably are thinking to themselves, wait a minute, I've experienced something. It might not even necessarily be corona, it could be because it's almost like we've forgotten that other health issues are existing right now, because everything is corona focused. We're forgetting that some people are still ill. There's, other health issues that, people are going through.
Absolutely. Yeah. And that does worry me too, because, people don't want to go to hospitals now. And, in my job, and I see somebody and I'm like, you really need to go to A&E. And they're like, oh, I don't really want to. And I'm having to almost convince them that to go,
Wow.
you might be having a heart attack. You might be having this. You need to go. So that's also something that I'm worried about. That what happens to all these people? They don't magically disappear. They still need help too.
100%. And I want to urge anyone even that might be, listening in right now, please do not think that just not saying anything, or not going into hospital, not speaking to a doctor. Of course, there is everything that's saying, try to avoid it. But if you know that you're feeling unwell, don't think, oh, if I go in, I'm going to catch something, or I'm going to catch that. You could actually be doing yourself a disservice. But what's actually interesting about that is that actually that seems to be one of the reasons that contributes to a lot more Black people and people from ethnic minority groups. I don't really like the term ethnic minority, but we're just going to use the term for this conversation.
I know it.
BAME people, just put them together. Black
yes. Okay.
We'll just lump everyone together. But a lot of the reasons as to why BAME people actually are being more severely hit. And this is one of the things that I've kind of struggled with. So I was obviously watching, I saw on your Instagram, actually, you posted a video from a doctor by the name of Dr. Anthony Fauci. So he is one of the people that's kind of working alongside Trump and everyone in office at the moment to try and obviously combat this disease. And you posted the video, and he actually had some stats on there, which let me see if I can quickly find, because I screen grabbed it. There we go. So in Chicago, for example, more than half of all COVID-19 positive test results and 72% of recorded virus-related deaths have been among African Americans, who make up just 32% of the city's population and 15% for the state of Illinois. But now, one of the things that he actually spoke about in there was the fact that, and by the way, if you don't know who Dr. Fauci is, he's basically an American physician and immunologist who has served as director of the National Institute of Allergy and Infectious Disease since 1984. So just so that you know that I'm not just picking a random person to gather information from. But he spoke about these disparities, but he said, and quote, this is what he said: it's not that they're getting infected more often, it's that when they do get infected, their underlying medical conditions, so the diabetes, the hypertension, the obesity, the asthma, these are the things that wind them up to ICU and ultimately give them a higher death rate. So then my question almost was like, so can we then say that there are disparities when it comes to the health service, or is it genuinely just that we're just not as healthy? You know, where does that question
No. And this is something that I can talk about for days. I don't have days. I have what's left of 20 minutes.
About 20 minutes, which is insane because we have so much to talk about. But yes, go ahead.
But the thing is, I did a public health master's, and that talks so much more about all this. And we put it together and we talk about the wider determinants of health. Right. Your health is due to a combination of your genetics and your lifestyle. And obviously your genetics, you can't change, but everything else it's like a spider's web. They connect with each other. Yes, Black people, we tend to be more unhealthy. We tend to be overweight and obese. We have all these problems like blood pressure, diabetes, etc. But then when you look at it, we're living in areas with reduced access to gyms and facilities, reduced access to health foods. Usually we're surrounded by chicken shops and takeaways and things, and so-called food deserts, which talk about this whole phenomenon. We don't get good access to healthcare. Usually, doctors are, we're not living in areas where we have good access to health facilities. So it's no wonder when you look at each and everything. Yes, we do eat a lot, and a lot of people do need to look at portion sizes and things. But when the system is engineered in a way for you to fail, it's no wonder that you're going to fail. It's harder for people to do the right thing when they're surrounded by all these influences on their health. So I think that's what he was talking about. And yes, we do need to address all the diabetes and everything else, but we're going to do that as well as focus on changing legislation, improving, housing, talking about things like asthma. If you live in a council house that's full of mold, dust, you're surrounded, you're living in a city where cars and vehicles are traveling past you, of course, you're going to have worse asthma than somebody that lives in a farm somewhere with fresh air. So it's all these things that affect our health. So it is a problem, but it's a problem that's within a problem, if you see what I'm trying to say.
No, 100%. And I guess there's so many layers to it, which is which is why I was kind of picking out all these different ideas, because I wanted to really explore it in the way that we are now. And actually just wanted to read out a comment from Khadija. So Khadija Dream says, just to put it out there, I know a family member that was not feeling well and went to the GP and was told it's nothing, but persisted and they found out it was cancer. Trust your intuition. Have you heard stories like that? I'm sure that you deal with people all the time. Yeah. How often do you hear stuff?
I will say, to Khadija and to anybody else, that is always a doctor's worst nightmare. Honestly, that's the kind of thing that will keep you up at night. Like, nobody ever wants to miss something like that. It does happen. I'm not going to deny it doesn't happen. But again, I agree with you. Trust your instincts.
Yes.
That's why I always say, you know your body better than I do. If something's not right, keep going until you get to the problem. Obviously, you take on board advice as well from other people. So you don't just close your ears and la, 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 la. But keep going until you get some sort of a resolution. Listen to your body and get the help that you deserve.
100%. I love that. Listen to your body and get the help that you deserve, by the way. Because some people...
Absolutely.
Yeah, because I feel as though sometimes, especially with like, you know, I come from an African background. So both my parents had migrated over from Congo. So very similar story, you know, immigrant story, etc.
Yeah.
But you actually hear it more often than you should. People just enduring things because they feel like, oh, it's too much of a bother, too much of a hassle. And I'm like, wait a minute, this is your right to be able to have access to healthcare. It's your right to be able, I mean, you pay taxes. That's what it goes towards. So
you're a contributing member of society, you're doing something. So come on, take it, claim it. It's your right. Do it, because
right,
someone's gonna do it for you.
100%. I agree. And I actually wanted to shift the conversation just a little bit towards vaccines. Now, there's been so many different things. I mean, every time I type in, you know, should or shouldn't we have vaccines, there's the anti-vaxxers on one side, then there's the people are like, you know, vaccines have saved over 10 millions of lives. And there's always these conflicts between vaccines. Now, of course, across different parts of the Western world, there's kind of almost like a race to see who can get to the vaccine first. You know, Trump has already stated that he believes that by January they should have a vaccine already. The UK is looking at research and seeing how it all works. But in general, I just wanted to ask you, in general, what are some of your opinions about vaccines, vaccinations, and people's skepticism at the moment?
First of all, you're speaking to a doctor, so already you kind of know what I'm going to say. And I'm going to say, as a doctor, and I believe also as a person as well, that's kind of done a bit of research into it. And I believe that overwhelmingly vaccines are good. That's my thing. And the reason being is from what I can see. When I went through medical school, we were learning about diseases that, oh my God, I was like, what the hell? You know, like when you're watching House and they're talking about dengue fever or something, or polio. Nowadays, where are all these things? Because of vaccines, we've eradicated them. And actually, when you look at COVID-19, this is another health issue that clearly shows why we need vaccines. Because over the course of history, they have helped to reduce the impact of a lot of diseases that would have done damage. I mean, everybody's worrying about coronavirus. Imagine back then when there was no antibiotics, no vaccines, and people dying. You know, like nowadays you can expect to live up to a reasonable age. Back then it was like a blessing for you to go past 50. And that is because of all these initiatives that we've done. So from my perspective, I know there's a lot of doubt about risk of certain conditions and things like that. Until I get evidence to the otherwise, I'm going to choose to believe in the effects of vaccines because I've seen it. And the numbers show the benefits as well.
Okay, well, let me throw this out to you one more time, because like I said, we've got a doctor. So this is the perfect time to kind of really pry open some of these questions. Because again, because I feel like I'm a bit 50-50. I don't know where I stand just yet. I'm very 50-50. Of course, when I was younger anyway, it was recommended to our parents to get vaccines. So I have been vaccinated for certain things. Thank God I've never had to experience those diseases, whether or not it was just my body or the vaccines itself. I'm not 100% sure, but some of the kind of skepticism that has come from it has been things like people feeling as though because vaccinations is a money, almost like a money making scheme. I don't know if that's the right terminology to use, but people make money from it, right? So people, for example, like the likes of Bill Gates with their Bill Gates Foundation, there's a lot of questioning as to why someone like Bill Gates is so invested in there being a vaccine. Though it seems as though he's trying to support people and help people, I have seen words around and people kind of flying around and saying, well, he is going to gain a lot. He's going to gain billions and trillions of pounds if he creates this vaccine and then sells it on. But then some people are saying that actually no, he won't gain financially. And then even other people, anti-vax people who are basically against vaccines. I remember seeing even some stats. Someone gave an example about negative effects that vaccines have had. So in April 1955, more than 200,000 children in 5 Western and Midwestern USA states received a polio vaccine, in which the process of inactivating the live virus proved to be defective. And within a few days, there were reports of paralysis. Within months, the whole program was shut down. So I think that while, it's easy for you to listen to your doctor and say, yeah, you know, if your doctor says this is good for you, then it must be good. There's also a little bit of skepticism because of some of the history vaccines have had, some of the questionable things that people that are super rich have done. So where do you kind of stand, even with kind of knowing that information?
I know that, and I understand, because, you know, through the history, there have been some, you know, iffy moments with vaccines and vaccine programs, and even just with drugs and medications in general. And I know it might sound as if I'm excusing the whole process, but when you look at the process of creating a new vaccine or a new medication, there has to be, you know, it's a stepwise progression. It doesn't happen overnight. And that starts from the whole process of research and development, which is done in labs, all the way to you getting it in your arm or wherever. And that process can take years. And they're usually clinical trials and things to try and make sure that it's as safe as possible. The thing, though, is that whatever you have, whether it's a vaccine, whether it's paracetamol, whether it's anything, does have the potential to cause side effects. And I'm not going to deny that that is not a possibility. Whenever you go somewhere and you buy a new medicine and you read the packet, there's a long list of things that potentially could happen. And that's the same with vaccines as well. And it's the responsibility of whoever's advising you about these vaccines to talk to you about these and make sure that you understand. But we've got to a stage now that we have refined, the royal we, but they have refined the process that, look, with every new bit of information that we get about these vaccines, we make them safer. And we cut out a lot of the issues that we're having because we're using a lot more technology. A lot of vaccines are either inactive or they're synthetic or they're modified in a way to reduce as many side effects as possible, while ultimately promoting the benefits. Because the alternatives of things like measles, of things like, polio, etc., it really is. It's not a good world to live in when, people, it's the same way that people are rushing to find a cure for cancer. And in order to get to that stage, we're still going to have to do clinical trials and things like that. But imagine telling somebody with cancer, I've got this cure for you, which potentially could have side effects, but then, and that person saying, "Oh, sorry, I don't want to take it." You would look at them like, why wouldn't you want to do something like that? So it's the same thing. I understand the concerns. There are things, and ultimately, I probably, if I had more time and I was sat in front of a mom and who wants to immunize a daughter or a child, I'd have more time to go through these things and make sure that they had every bit of their questions answered and made sure that they were happy before they chose to go ahead or decide not to go ahead, which is their right.
Yeah, and I think that's what I actually wanted to ask you about, the right that people have to accept vaccinations or not. One comment I actually want to go to, so Steph A said, apparently Bill Gates' aim is to reduce the population in the world, which is actually something I've heard quite a lot. I've heard a lot of people. Dr. K took a moment. I saw you take a breath there. She took a breath. She said, "Oh my gosh." But these are the kind of things that, and the crazy thing is, I listen to all sides because I think it's important to understand where people are coming from. I'm not going to lie. The things that we've uncovered of history and people in power, I wouldn't put it past some people to really create schemes and plans in order for them to fulfill an agenda that might not necessarily be what they're telling people. So that's exactly why I like this platform, and I wanted to create something like this, because I want people to be able to share their opinions and their thoughts, but for us to also be able to hear from professionals like yourself, to kind of hear what you say. But I wanted to actually talk about choice during this time. So apparently right now the UK doesn't necessarily have a fixed law or anything like that says you have to take this vaccination. But at the same time, it seems as though a lot of people might be pressurized into it. Where do people kind of stand? If someone says, I don't want to take the vaccine, where does that kind of stand for them? Do they still have to take it, or what do they kind of do in that aspect?
The black and white fact is that no, you don't. As long as you're fully informed of the risks that you run in not doing so, and you weigh it up against the benefits that you think from not having it. So it's always a decision. As long as you have a sound mind and you're an adult, or if it's in the case of a parent with their children, they've made that decision and you've come across it and you said no, well, there's nothing I can do about it. It doesn't mean that I am happy about it. I mean, it's the same as, a parent that's looking at their their adult child, and the child is like, well, I'm going to do this. Well, okay, you can do it.
Right.
That's the same approach. So, and I come across parents, I don't come across them often, because I think a lot of people are much more, they kind of, I think once you've sat down and explored why people are not wanting to have vaccines, and you take that time, and I think that's what's lacking, that a lot of times as health professionals, because we're often stressed for time, we don't have time to sit down and say, okay, so what's bothering you about this? What are the risks that you're worried about? And then go through with you. And that's a shame, because I wish I could do that a lot more. But if we have the time to do that, a lot of times people then say, okay, now that I understand, fine. It's one thing to make a decision, but then it's another to make a decision knowing the full picture, and also putting it into context, because, we're now living in an age of misinformation and fake news. I understand what you're saying, Nissy, about weighing up both sides, but then you also have to be proportional, because one side might only be 25% of that equation. The other might be, 75%. So you have to also put it into context as well.
Right, 100%. And I agree. And I think being very informed and making sure you do research. And I know, of course, there is already, in fact, before Corona, there was already so much pressure on the NHS and doctors and health professionals. So I can only imagine where it is now. So it's very important that we make sure we make informed decisions. I actually just wanted to ask you, in regards to kind of more holistic or more kind of like natural remedies. I remember I was watching, I think it was Good Morning Britain at the time, and there was like a mum that came on with her kids, and she was saying how they've never had vaccines. Everything is very holistic. Everything is very natural herbs. And you also hear some people, even Africans actually, arguing that say, when we were, back home, we use certain things like gingers and natural products, natural fruits. What are some of your thoughts about a more kind of like natural approach instead of a vaccine?
I am waiting a fine line, because I do think, actually, even though I'm a doctor, a lot of things you don't need medication for. Okay. Not every cough needs antibiotics. Not everything needs the full work. So I'm in favor of people using self medication, honey, lemon, ginger, for things like that. Absolutely fine. But there are some certain medical conditions that we know about. We've known about them for, since the 1950s. We know how it works. So things like, let's say, blood pressure, for example, we know how it can affect the body. And diabetes, we know again. And that's something, unfortunately, no matter how many slices of ginger or lemon that you use, because of how it's like when you have a computer, a machine, we've taken apart the parts, so we know how the wiring is. And we know that the cure, the treatment is this specific part. So you then say, I'm going to use lemon or herbs. That is not going to do anything. So yes, I do think using, and I also believe in the power of exercise and mental health and mindfulness. And I think a lot of times that can be just as effective as anything that comes out of a tablet. So I really want to encourage people to focus more on alternative and holistic therapies for treatments for things that are, generally, minor or things like that. But I mean, somebody coming to me now and saying I've got cancer and I'm going to use some herbs, I am going to look at them all sorts of ways, because that is not really, I mean, I believe in miracles, things can happen, but I really feel that you want the best chances to win in life. And you know how they say, get on the winning team. Get on the team that is going to get to the solution.
Right. No, thank you so much for sharing on that. And just looking at some of the comments, actually, Jessica Katanga said, herbal remedies are very important, but remember herd immunity, which is actually something that, again, a lot of people have kind of questioned, like, you might not necessarily get it, but somebody else, and then you might be immune to it, but then somebody, is always that question of, is it selfish? Is it not? It's a very, very tricky one. Very, very tricky one. Khadija also added, as a parent, I would be heartbroken if I didn't vaccinate my child against a condition and then my child ends up getting that condition. So I guess, like you said before, it's about risk, and you analyzing the risk and seeing whether or not you think it's right.
Yes, absolutely. Absolutely.
Wow. I think, you know, I don't have any children, but already I'm kind of like, oh my goodness, I don't know how old I would be, would respond. Time, I can't even believe it, but we literally only have a couple of minutes left. But Junior said, would you say that a parent neglecting their child from vaccines is a form of child abuse? That's a heavy question. What are some of your thoughts on that?
I have heard it. I've heard it from some other health professionals who are very militant and very strong about their opinions. Generally, these tend to be older doctors and nurses that have kind of lived through that whole period where they've personally seen the effects of things like, you know, TB, measles, rubella. They've witnessed what it was like. So for them, they can't comprehend how somebody can go away and not do it. I wouldn't go as far as saying it's child abuse, in my opinion. I would I would really try my best just to make sure that they understand the full implications of what they're doing, though.
Yeah, no, 100%. And I think if there's anything that we've learned from this conversation, it's just making sure you weigh up all the factors. You know, don't get so stuck in, I guess, one area that you're fixated on that. Weigh up as many of the factors as possible, do your research. And ultimately, we do live in a democracy. So if people want to choose not to do something, they can, but that is a risk that you have to be willing to take. But Dr. K, before we run, I want you to let everyone know, first and foremost, just one thing that you would encourage them to do during this time, you know, just to make sure they stay safe, to look after themselves. I know we've got so much information out there, but is there anything that you would particularly just want them to say or want them to do? Sorry.
I would probably say to keep doing what you are doing, because obviously we're now in week 8 of isolation. So I think it's shown us how, despite distance and despite pandemics and despite hysteria, we are still, you know, as a human race and as people, still managing to find ways to connect with each other. I mean, me and you now, we're, you know, we've been talking for an hour and we're connecting. We've got an audience of people as well who are listening. We're finding ways. I mean, and I think that's the thing about the human race, that we are very innovative. It doesn't matter what situation we're in. We are going to be here, you know, a year from now, centuries from now, and we will thrive and we will survive. So in terms of any specific tips, I don't think that I am the expert. I'm doing what works for me. Whatever works for you to get you through this period in a way that you feel is best is fine. Don't neglect your health, though. Don't neglect your family. Use technology in a way that benefits you and stay informed. That's all I can say.
I love that. And if people want to follow you, if people want to interact more with you or ask you questions, please let them know how they can get in touch with you.
Yeah. So I have my YouTube channel, which is Dr. K Explains, all one word, Dr. K Dr. K Explains.
Okay. Yeah.
And that's where I'm most active. I usually do videos on different health topics. And then also I have my Instagram, which is also the same handle, and Facebook as well. So they can reach out to me, send me a message, send me ideas on what videos they want to cover, and I'll be happy to hear from them.
No, most definitely. Guys, honestly speaking, I love Dr. K's Instagram, especially because I'm normally 90% of the time I'm on Instagram. And, you know, she has some great videos on there breaking down some really good advice, really good information. She's honestly amazing at what she does. Once again, we honestly applaud you. We appreciate you for everything that you're doing and just all that you're sacrificing, basically, to make sure that other people are well. So we applaud you. We appreciate you. And thank you guys as well for locking in, for coming on. You know, Tumi, Junior, Khadija, Steph A, Dave East, every single one of you that got involved in the conversation today. We will be back next week, Sunday, with another special guest, which I'm very excited for as well. And we'll be having another in-depth conversation. Remember, in conversation with Nissy Tee, in association with Little Drops Production. So sad that we can't do it in person. It would have been amazing to see you in person, Dr. K. But this is also nice. This is also nice. You have been amazing.
Thank you. It's been a pleasure. Love it. And thank you to everyone that tuned in as well.
Thank you so much, everyone. Have an amazing evening. And remember, please stay safe during this time, okay? I'll see you guys again next week. Take care.